Welcome, parents, to today's Explainer. If you're joining us, it's probably because you've noticed something about the way your little one is communicating, and you're out here looking for some real answers. Well, I am so glad you found us. Today, I'm going to walk you through exactly how we do things at Next Level Speech and Physiotherapy Center, Dubai's premier rehabilitation clinic right here in JBR. We're going to completely demystify speech and language development so you can feel empowered, informed, and truly confident about your child's journey.
You might be feeling exactly what this quote captures. I understand my child perfectly, but other kids give them blank looks. Honestly, we hear this deeply empathetic observation almost every single day in our clinic. Think about it. You've spent years tuned into every single little sound your child makes. To you, it makes total sense. But then, a relative asks you to translate for them. Or a teacher gently pulls you aside at pickup. Or worse, you see those blank stares from their classmates on the playground. We absolutely know how incredibly anxious this makes you feel. Your child's voice is beautiful, and watching them get frustrated because they aren't understood, it's really tough.
Okay, let's dive into this. That anxiety you're feeling usually boils down to one massive question. When is this just a phase that they're going to outgrow, and when is it an actual speech disorder that needs professional support? In our clinical experience, most kids do mispronounce sounds when they're young. It's totally normal. But today, we're going to explore exactly how our expert team figures out when those little mispronunciations have hung around just a bit too long and when it's time to step in and help. To get us there, we've put together a super clear roadmap for this explainer. We'll start by figuring out if it's just a phase, then break down the mechanics of articulation, explore phonology, talk about raising bilingual kids without the confusion, dive into our proven therapy approach, and finally, talk about taking that crucial next step.
So, Section 1. Is it just a phase?
Let's talk about how we expertly spot the difference between typical childhood development and a true clinical concern. And just to put your mind at ease right out of the gate, our framework isn't just some textbook theory. It is backed by hands-on experience supporting over 7,000 children and their families. Over the last 11+ years, what we've consistently found is that properly assessing a child means looking at the whole picture, their age, their environment, and the actual mechanics of how they speak. Which leads us right into our first major category of speech challenges.
Section 2. Articulation. Producing the sounds.
So let's shift gears and look at the physical, mechanical side of speech. An articulation disorder is basically a difficulty producing specific speech sounds correctly. It all comes down to the physical coordination of the lips, the tongue, the teeth, and the breath. I always love to remind parents, a child with an articulation disorder knows exactly what they want to say. The message in their head is perfectly clear. It's literally just the physical hardware of the mouth that's struggling to execute the movement.
So what does this hardware struggle actually sound like? Well, here are the most common sounds our DHA licensed therapists look for. You might hear a child substitute one sound for another, like saying wabbit instead of rabbit. Now that is incredibly cute at age 3, but it becomes a clinical marker later on. You might hear a lisp, where an S comes out as a teeth. But listen, here's what really matters: their age. Some sounds just naturally develop later, but if that S sound is still unclear past age 5, or the R sound is missing past age 7, that's a missed milestone. And of course, the biggest red flag is consistent frustration. If they are embarrassed or hesitant to speak up, it's definitely time to look a little closer.
Section 3. Phonology. Organizing sound systems.
Now, what's really interesting about this next concept is how it contrasts with what we literally just talked about. We just defined articulation as the physical hardware, while phonology is the cognitive software. It's the whole sound system of language, the internal rules and patterns that dictate how sounds work together. This is a massive distinction we make every single day at Next Level Speech. A child might be entirely physically capable of making a K sound, but their brain software just hasn't internalized the rule for where and how to actually use it in a word.
Because of this, phonological disorders involve systematic patterns. A child might consistently drop the final sound of every single word they say, or simplify a word like train to tain. In our clinical experience, we find that parents often worry their child is just being, well, lazy with their speech. We emphatically reassure them, no way, this is absolutely not laziness. These systematic errors are just a reflection of how a child's brain is actively trying to organize sounds. And since the root cause here is cognitive, the therapy we use to target it is completely different from how we treat articulation.
Moving on to Section 4, bilingualism without the confusion.
Okay, this is a massive, urgent topic for the multilingual families we support across Dubai Marina, JLT, and beyond.
Living in Dubai is incredible. Your kid might literally hear 3 different languages before breakfast. But because of this, there's a really damaging myth floating around out there. The myth says that bilingualism causes speech delays, and that mixing languages, what we call code switching, means your child is confused. We need to bust that myth right now. The truth, based on everything we see at our center, is that code switching is a sign of high linguistic sophistication. Mixing languages is completely normal. It is absolutely not a reason to stop speaking your beautiful home language. So the crucial point is knowing what a true bilingual delay actually looks like. When we assess a child using bilingual norms, we're looking for limited communication attempts across all their languages, not just one. We're looking for totally missed basic milestones, difficulty understanding instructions in their strongest language, and signs of real frustration or withdrawal. You see, a bilingual child assessed solely in English using monolingual norms will almost always incorrectly look like they have a delay. That's why getting the assessment right the first time is just everything.
Section 5. Our proven therapy approach.
Let's walk through the highly engaging methods we use at Next Level. If we're tackling an articulation issue, that physical hardware problem, our structured therapy journey looks a bit like climbing a ladder. First, we start with the sound in total isolation. We're just getting the physical movement of the mouth right. Then we step up to syllables, move on to words and phrases, and finally, we integrate it into natural conversation. We make sure each step is rock solid, progressively building up your child's confidence and clarity through really fun, playful sessions.
But if we're treating a phonological disorder, that software issue, our approach completely flips. We target the underlying rules using clinical techniques like minimal pairs and cycles. We aren't just drilling a single sound over and over. We're essentially teaching the brain a brand new rule. And this is exactly why a proper diagnosis is so vital. When you target the underlying pattern, you very often see broad, rapid improvements across multiple different sounds all at once. We're basically working smarter, not harder, to lift their overall clarity.
But hey, we don't do it alone. As we've seen in our work, home practice is the secret ingredient. Here's your playbook for maximizing progress. Just 5 to 10 minutes of daily practice is all it takes. Keep it light, keep it playful. Keep giving them rich exposure to your home language. Seriously, never drop your mother tongue just because they started at an English nursery. And celebrate every single small milestone. Consistent, short daily practice in your family's natural home language accelerates progress immensely.
Let's move to our final section and see how this builds. Section 6. Taking the next step.
Everything we've talked about today is built on over 11 years of dedicated authority and specialized experience. At Next Level Speech and Physiotherapy Center and Fattan Marino Business Hub, we pride ourselves on being Dubai's most compassionate, top-tier pediatric rehab clinic. We deeply understand the multilingual context of the city, we know the nuanced difference between hardware and software speech issues, and most importantly, we know exactly how to make your child feel safe, understood, and confident.
So, I'll leave you with this ultimate question. Are you ready to help your child find their clearest voice? Because those crucial developmental windows, they don't stay open forever. It's time to replace the endless anxiety of, is it just a phase, with the clarity and relief of a definitive plan of action. Reach out to our team here in Dubai today. Let's unlock your child's full potential together.